Nutritional management in children with congenital heart disease. What actually do we hope from these children? A child grows rapidly in first 1000 days of life from conception intrauterine until age of 2 years old. During this critical period, all of organs and tissues are being formed and developed, especially the brain. What we can measure from child's growth are heart circumference, body weight, and body height. We use growth chart to review growth and development of a child. If a child's growth line is still in the green area of the chart, the child has already had a good nutritional status with normal growth. This child does not need any treatment. If a child growth line has already reached the yellow area of the growth chart, the child has already had a mild moderate malnutrition. But this child also does not need any treatment yet. If a child's growth line has reached below yellow area of the growth chart, the child has a severe malnutrition and needs to be reversed. Actually, if there's a decline in the growth line of a normal or undernourished child, it indicates a growth problem to be investigated. We should look for the causes such as illnesses or nutritional feeding problems. If there are 2 episodes of growth decline consecutively, this child should be referred to pediatrician. Infants and toddlers in Indonesia usually have growth faltering from 4 months old. When we realize it in the age of 18 months old, it has already been too late because the child has already severely malnourished. This chart shows condition of malnutrition takes process, so we should increase our awareness when assessing growth delay so that we can have early detection of malnutrition to prevent malnutrition itself. When is congenital heart disease usually diagnosed? First, when the fetus is intrauterine, prenatal period. Second, when the baby is born, in natal period. Third, when the baby has already born and grown, postnatal period. Congenital heart disease can be divided into many types, whether it's single or multiple condition, cyanotic or acyanotic, with or without complications including heart failure. What we should assess from a child with cyanotic heart disease is whether he or she has already taken medication routinely or not. A child with congenital heart disease can grow normally or fails to grow. A child with congenital heart disease should grow normally to have surgery in the future. The problem is this child has higher nutritional requirements. On the other hand, he or she has decreasing eating ability because of his or her health condition and malabsorption condition. Growth of child with congenital heart disease has a cycle. Malnutrition or stunting or growth faltering relates to nutritional factor, which correlates with the condition of the disease itself. This condition is also supported with early food access, parenting style, medical service access, and environment of the child. Growth delay in congenital heart disease is caused by high nutritional requirements, reduced quality of nutrition, reduced ability of food consumption, malabsorption, and high incidence of infection. To have a good nutritional status and growth, the food should consist of adequate calories, especially from meat, egg, and dairy base, adequate micronutrients with various diversity of food. There are 3 nutrition plans which can be used to fulfill the needs of a child with congenital heart disease. Plan A is given for a child with congenital heart disease who is asymptomatic and grow normally. Nutritional requirements can be fulfilled with like a normal child with breast milk, formula milk, or family food. But his or her growth still need to be monitored routinely. Plan B is made for the child with congenital heart disease who can't grow normally or can't fulfill their basic nutrient needs with normal food. He or she can drink less than 120 ml per kilogram birth weight and eat more than 75% food orally. He or she should be given with high nutritional food because he or she needs extra energy and protein. This child can be given breast milk with human milk fortifier and thickened formula milk. Plan C is made for the child with congenital heart disease with malnutrition. He or she needs fluid restriction with fluid volume less than 100 ml per kilogram. He or she is given 120 until 150 kilocalories extra calories and 50 until 100% extra high quality protein with base on dairy or meat or egg products. If the child is given breast milk, it should be combined with supplement or thickened formula milk. Placement of nasogastric tube can be considered. Weaning food can be started from 6 months old. The amount and consistency of weaning food can be increased gradually. The ingredients of weaning food consist of rice, meat, vegetables, oil, or butter. Weaning food should be given when the child is in sitting position for less than 30 minutes. And weaning food is added between breast milk schedule. The benefit of cardiac surgery in a child with congenital heart disease is catch-up growth which resulted after surgery. Improvement of oxygenation after cardiac surgery makes intestines absorb nutrition better so that the child can have a better growth. Thank you.